Hi everyone, it's a great pleasure to talk on child development and parenting. This is a topic which is very close to my heart. I have been into practice for past 16 years, and these 16 years I have been busy dealing with children of developmental delay, ADHD, autism, dyslexia and cerebral palsy. What has touched my heart so far is lack of awareness regarding these neurodevelopmental disorders and lack of early identification of these disorders. For creating awareness, we need to educate parents, teachers, doctors and general public. Because of lack of awareness, generally these problems are overlooked and we miss out on important years of child development, which are first 2 years of life, especially first year of life. Adult brain is reached by 5 years of age and 90% of brain is formed by 2 years of age. When we talk about a child development, we talk about development in all the 4 areas: social development, emotional development, physical development and mental development. Child development is very complex. It starts quite early. I am sure most of us must be thinking that child development starts after birth, but no, it starts much earlier. It starts at the time of conception, where sperm and ova meet and they form a zygote. So before conception, before conceiving, parents should be counseled. Parents should be advised to keep a gap of 3 years between 2 pregnancies, and mother, if she has any disease like diabetes, asthma, thyroid problem, hypertension or epilepsy, she should be counseled and she should be treated properly to avoid any congenital anomalies in her child. First 3 months of pregnancy, organs are forming. This is called the period of organogenesis. After 3 months of pregnancy, these organs are increasing in size. So these first 3 months of pregnancy are very crucial. If mother is ignorant about certain things, then child can have congenital anomalies later on. It has been seen, this is scientifically proven, that child learning starts when child is in the womb. Whatever this child is hearing, he or she becomes very much familiar to mother's voice, because most of the time it is mother's voice which he is listening. Mother's voice is transmitted through amniotic fluid to the child. Not only mother's voice, whatever mother is tasting, whatever mother is smelling, all those things are getting transmitted through amniotic fluid to the fetus. Apart from this, whatever mother is eating, it has been seen that if mother is eating carrots, then child is familiar to this kind of food after birth. So learning starts quite early, about which general public is unaware. So parents, there are certain things which should be taken care of during pregnancy, and parents should be counseled. Mother should be given proper care. First thing is that if mother has any disease like diabetes, asthma, thyroid or hypertension, these medicines should not be taken without doctor's prescription, because if these medicines are taken, they can result in congenital anomalies. Mothers should be vaccinated for rubella infection before conception, because rubella infection during pregnancy can result in vision impairment, hearing impairment, congenital anomalies and low birth weight baby. Mother should take folic acid tablets during first 3 months. Folic acid is taken to avoid neural tube defects in our child. Mother should take iron and calcium tablets after 3 months of life. She should not take too much of physical stress. Family environment should be good. It should be calm. And she should sleep at least 2 hours in the daytime, and 8 hours sleep is must during the night. Mother should not smoke or take any drug or alcohol during pregnancy, because again these things can result in such kind of things can result in congenital anomalies and low birth weight baby. Diet should be really good. She should take diet rich in iron, calcium and proteins like She should take, she can take egg if she is non-vegetarian, or she can take cheese, she can take green vegetables, she can take fruits and pulses, etc. If what can go wrong if mother doesn't take proper care during pregnancy? Child can have microcephaly, child can be premature or low birth weight baby, or he can have developmental problems after birth. There are many factors during birth and after birth which can influence a child's neurodevelopment. If a child had a delayed cry during birth, or child had neonatal sepsis, neonatal hypoglycemia, hypothyroidism, hyperbilirubinemia means if child had jaundice which is not acceptable, levels are quite high, or if newborn is premature, low birth weight baby, or he was admitted in the nursery, or he was on the ventilator, and such type of neonates, they are called high-risk newborns, and they are quite susceptible to neurodevelopmental delay later on. There are certain other problems which such kind of neonates can face. These are cerebral palsy, autism, ADHD, ADHD is behavioral issue. They can be short-tempered, they can be hyperactive, they can be impulsive in nature, or they can have social maladjustment. They can have learning problems, they can have vision or hearing problems. Such kind of newborns, after birth, as developmental pediatrician, they realize that such kind of newborns are definitely going to have some problem later on. So these high-risk newborns are given early stimulation after birth. This stimulation is called as early intervention therapy. This therapy is a form of intervention in which certain passive exercises are taught to the mother, and they are given in the centers. Children are advised to do certain kind of play activities, and parents are taught to tackle their child in a different manner. Certain chromosomal anomalies like Down syndrome or metabolic disorders in children, or genetic disorders, can also result in developmental delay or learning disabilities or dyslexia or cerebral palsy. Down syndrome is seen in those children whose mothers were more than 35 years of age during pregnancy. First 1 year of life is very crucial because every day millions of neurons are forming in the brain, millions of neuronal pathways are forming in the brain. If these connections are not used, then they are pruned away. So we are missing out on an important part of the brain. We are wasting potential of a child. So this early stimulation of a newborn has its own significance in preserving those neurons. During every vaccination visit, children, these newborns or these infants, they should be assessed for development also. Parents should be taught what are the normal milestones of every child. When a child is supposed to smile, when a child is supposed to sit, when a child is supposed to have neck coating. So that if there is any deviation from normal, they can note this thing and can consult their doctor or developmental pediatrician. Apart from medical conditions, there are certain other things which are very important for child development. That is family environment, parental attitude, child nutrition, hygiene, and socio-economic status of the family. If parents are fighting most of the time, then child learns the same thing. His behavior gets modified. He grows up as an irritating, hyperactive, and an adult who has social maladjustment. If parents are loving and caring, they are giving enough time to their child grows up as a satisfied adult. Child nutrition is also very important. Child diet should be rich in iron, calcium, protein, and vitamins. So, mother should be educated properly as far as child nutrition is concerned. Family environment should be stress-free. Parents should spend quality time with their child. They should play with the child, and during play, they should teach good things to their child. Just to sum up whatever I have said till now, During pregnancy and before pregnancy, parents should be counseled. After birth, they should take proper care of their child. Family environment should be stimulating. Nutrition should be good. Child should be vaccinated properly, and on every vaccination visit, child should be assessed as far as its development is concerned. Thank you.